Across America's rural heartland, a healthcare crisis has quietly deepened for decades, often escaping the national spotlight. In these vast stretches of farmland and small towns, the challenges are not just about distance, but about access, resources, and the very survival of communities. Today, millions of rural Americans face daunting obstacles just to receive basic medical care. For many, a simple doctor's appointment can mean hours on the road, navigating winding highways and empty fields. The closure of local hospitals has left entire regions without emergency services, forcing families to make difficult choices when every minute counts. The consequences are profound. Rural residents are more likely to suffer from chronic illnesses like diabetes and heart disease, and their life expectancies are often years shorter than those in urban areas. This isn't simply a matter of personal health decisions. It's a reflection of a system that has left these communities behind, unable to provide the care and support that everyone deserves. Financial instability and chronic staffing shortages have created a vicious cycle. Hospitals struggle to keep their doors open, while doctors and nurses are stretched thin, often working long hours with limited resources. As facilities close, it becomes even harder to attract new healthcare professionals, deepening the crisis and leaving patients with fewer options. Recognizing the urgency, the federal government has launched a sweeping initiative to address these challenges head-on. The Trump administration's plan is designed to transform rural healthcare from the ground up, focusing on sustainability, innovation, and community partnerships. This marks one of the most significant investments in rural health in recent history. This ambitious program aims to revitalize rural hospitals, expand telemedicine, and bring new resources to underserved areas. It's a clear signal that the health and well-being of rural America are essential to the nation's future, and that no community should be left behind. The ultimate goal is simple yet profound: to ensure that where you live, whether in a bustling city or a quiet farming town, no longer determines the quality or length of your life. Every American deserves access to quality healthcare, regardless of their zip code. Join us as we explore how this bold new vision could reshape the future for millions of rural Americans, offering hope, healing, and a renewed sense of possibility for generations to come. The Trump administration's One Big Beautiful Bill Act launches a $50 billion five-year investment to revitalize rural health systems. Unlike short-term grants, this program provides $10 billion annually from 2026 to 2030, giving states the stability to plan and innovate. The funding aims to modernize technology, expand essential services, and address long-standing gaps in care. For years, rural hospitals have struggled with unpredictable funding and razor-thin margins. This act replaces uncertainty with robust support. The scale of the investment signals a new national priority, closing the rural health gap for good. States now have the runway to pilot new models, measure results, and scale what works. This isn't just about money. It's about transforming how care reaches America's most remote communities. The $50 billion in federal funding will be distributed to states using a carefully designed two-part formula, ensuring both fairness and the encouragement of creative solutions. This approach is meant to address the unique challenges faced by rural communities across the country, while also rewarding states that go above and beyond in their efforts to improve healthcare access and outcomes. Half of the total, $25 billion, will be divided equally among all 50 states. This guarantees that every state, regardless of size or population, receives a baseline amount of funding to address urgent rural health needs. It's a way to make sure that no community is overlooked, and that every state has the resources to start making a difference right away. The remaining $25 billion will be distributed through a competitive process. States must submit detailed, forward-thinking plans outlining how they'll use the funds to transform rural healthcare. Those with the most innovative, impactful, and sustainable proposals will receive a larger share, encouraging states to think creatively and collaborate with local partners. In 2026, each state will receive between $147 million and $281 million, depending on the strength of their proposals and the specific needs of their rural populations. This range allows for flexibility, so states with greater challenges or more ambitious plans can access the resources they need to make a real impact. This hybrid funding model is designed to foster both collaboration and innovation. States are encouraged to work together, share best practices, and tailor their solutions to the unique needs of their rural residents. By combining guaranteed support with competitive incentives, the program aims to spark new ideas and drive meaningful change. Universal support ensures that no state is left behind, while the competitive element rewards those who push the boundaries and develop the most effective strategies. This balance helps create a sense of shared purpose, motivating states to strive for excellence while also lifting up those who need it most. The ultimate goal is to ignite a wave of innovation in areas like telehealth, mobile clinics, and workforce development, each customized to fit the geography, culture, and needs of every state. By empowering states to experiment and adapt, the program hopes to uncover new models that can be scaled nationwide. The result? A more dynamic, responsive, and resilient rural healthcare system that delivers better care and brighter futures for communities across America. This initiative isn't about building more hospitals, it's about making the system smarter and more efficient. The focus is on modernizing existing facilities, investing in technology, and expanding services like preventive care and mental health. By targeting chronic disease management and telehealth, the program aims to close the life expectancy gap tied to zip codes. Workforce shortages will be addressed with new incentives for doctors and nurses to serve rural areas. Flexibility is key. States can reimagine care, from mobile clinics to telemedicine hubs, based on local needs. Success will be measured by real improvements in health outcomes, not just new buildings. The mission transforms rural healthcare for the 21st century. Leading this ambitious effort to reshape rural healthcare is Dr. Mehmet Oz, the renowned physician and television personality who now serves as the head of the Centers for Medicare and Medicaid Services. Dr. Oz brings a unique blend of medical expertise, public communication skills, and a deep passion for improving the lives of underserved Americans. His appointment marks a significant shift in how the nation views rural health challenges, signaling a new era of leadership and innovation. Dr. Oz frames the initiative as a moral imperative, stating, "Your zip code should not predict your life expectancy." He believes that where you live should never determine the quality of care you receive or the opportunities you have to live a healthy, fulfilling life. This vision is at the heart of his mission to close the health gap between rural and urban communities. His leadership brings not only medical expertise, but also national visibility, making rural health a top priority for policymakers and the public alike. Dr. Oz's hands-on approach, meeting with healthcare workers, visiting clinics, and listening to local concerns, ensures that real voices shape the solutions. Dr. Oz emphasizes that this initiative is about true transformation, not just propping up struggling hospitals or offering temporary fixes. He envisions a future where rural hospitals are centers of innovation, equipped to deliver high-quality care and adapt to changing needs. His clinical perspective keeps the focus squarely on patient outcomes, ensuring timely diagnoses, expanding access to specialists through telemedicine, and bringing modern technology to even the most remote communities. Dr. Oz is committed to making sure that every patient, regardless of location, receives the best possible care. With Dr. Oz at the helm, the administration is sending a clear message. It is fully committed to real, lasting change in rural healthcare. This is not just a policy shift, but a promise to invest in the future of rural America. The program's success will ultimately be judged by whether it can break the link between geography and health destiny, ensuring that rural Americans have the same opportunities for good health as anyone else in the country. For rural America, this is more than just a policy. It's a doctor's mandate for a healthier, more equitable future, where every community can thrive. Accountability is at the heart of the new rural health program. States must meet clear benchmarks and show real progress to keep their funding. This is no blank check. The administration will monitor results and reclaim funds from states that fall short. States must report on key metrics: reduced ER visits, more telehealth, better recruitment of rural providers. Funding is tied to outcomes, not just intentions, ensuring taxpayer dollars drive real improvements. This strict oversight is designed to prevent waste and maximize impact. States are partners in a national mission, responsible for making every dollar count. The message: transform systems, deliver results, or risk losing support. This $50 billion rural health push arrives at a pivotal political moment. With midterm elections looming and rural voters a key base, the administration is making a direct appeal to communities that have long felt overlooked. Rural voters made up over a third of President Trump's support in 2024. This initiative speaks directly to their needs. The program offers a clear, positive message: real investment in rural well-being, not just rhetoric. It's a powerful campaign tool, showing action on a problem that matters deeply to rural families. In a tough economy, healthcare investment offers hope, and a reason for rural voters to stay engaged. The Rural Health Initiative launches as ACA premium subsidies expire, raising insurance costs for millions. Rural families may soon face higher premiums, even as local care improves. The challenge: better clinics and services, but pricier insurance to access them. The program's efficiency goals, like more preventive care and telehealth, could help offset rising costs. States must design proposals that not only improve care, but also ease the financial burden on residents. Solutions might include state-level subsidies or more affordable insurance options. The path forward requires balancing quality, access, and affordability for rural Americans. Ultimately, the true test of this $50 billion program is its impact on real families. For the farmer needing a specialist, it could mean a telehealth visit at the local clinic. For parents of a sick child, it's care close to home, not hours away. This is about restoring security and stability to rural communities. Accountability and innovation ensure this isn't just another government promise. It's a chance for real change. Every American deserves quality healthcare, no matter their zip code. For rural America, this initiative is a new dawn and a promise of a healthier, more secure future.